Hi, I'm Dr. Ledbetter with Aesthetics, and here are a few of the more common questions we tend to get. I honestly don't think it's too young, really, at any age, to at least get a baseline. Certainly, if you're in your late teens or early 20s, I would highly advise just getting a baseline of your hormones and figuring out where you're at. That way, when you're older, you'll have at least a starting point for where you were when you were younger and a metric with which to shoot for. Once you get into your 30s and 40s, yeah, I would start thinking about it if you're starting to notice things in your world that just aren't what you want them to be. So, anytime, really. So, the GLP-1s, very common right now for weight loss. Without getting too nerdy about it, basically what they're doing is and then GLP-1s are they're normal. You make it already. You make these same peptides and proteins already. And so what they're doing is they're changing your hunger signals so that you're not as hungry. They also influence your satiety signals so that you get more full quickly, and so they delay gastric emptying, and all of that kind of combines with making you feel more full earlier, so you tend to not eat as much. It also influences the way you use insulin and processed glucose so that you become a little bit more insulin sensitive, whereas most people in an American diet are more insulin resistant. And so all of those processes come together, and you end up losing a little bit of weight, having decreased inflammation, less sugar spikes, and many good things. Signs of low testosterone are pretty similar between men and women. Usually it's lower energy, maybe a little bit of brain fog, not recovering from workouts as quick as you used to when you were younger, low libido, um, yeah, things like that. So, in women, hormone imbalances can show up in a multitude of different ways. Well, we just talked about testosterone. Well, testosterone is a very important hormone in women, and the things I just spoke of, low energy, low libido, brain fog, um, low, long time to recover from workouts, things like that. But also, there's the estrogen and the progesterone and the pregnenolone, and there's several other hormones in the pathway that, especially the estrogen, can have different effects on women, so that they have changes in mood swings, things like that. They can also have some lower nether region kind of changes that are happening that they're not real happy with. Um, and certainly, people that are in the perimenopausal, menopausal phase, they've heard of hot flashes and night sweats and those sort of things. So, there's a lot of different hormones that can show up, and that imbalance can show up in a multitude of different ways in different women. Well, to know what treatments are right for you, you kind of have to know what's wrong. So that's why we do the consultations. That's why we do your lab work. We look at all of those things. I'll take a history from you and have a discussion with you, and then we come up with a customized plan for you. So one size does not fit all. It just depends on what's going on with you and then what you're trying to achieve. Those are just the answers to a few of the common questions we get. Really appreciate you listening to our newsletter this month, and hope you come and visit us, and we'd love to see you.